co-lead Rise, which is one of the OHT support partners across the province. And this is the 5-step model that we've introduced in Ontario. The first step is really around identifying who the population is. And then it's really understanding the needs of those patients and populations using data. Second step is really around segmentation then. It's really to try to divide people into different categories based on needs, risks, and barriers to care, so that we can develop care models that are particular for the different subpopulations that we serve, often called priority populations. Once we've segmented populations, then it's all about designing the mix. It's around bringing evidence-based care into the mix and co-designing person-based pathways that are tailored to those particular segments and adapting them to be equitable. Then next, it's really around implementing these co-designed care pathways, and we can certainly help people around the mechanics around co-design. Implementation is really around reaching the entire population so that we actually reach all the attributed population, not just the ones who come in the door, and then gradually learn by monitoring, evaluating, and changing. So that's the population health approach, the population health management that we've been applying. This picture represents an overall representation of a general population segmented into 4 different groups: healthy patients, rising risk, increasing complexity, and high users. And as you move up this pyramid, luckily the size of the levels shrinks, but as you move up the pyramid, the health risks, the equity barriers, and the medical complexity increases. And that means that you also have increasing needs for clinical, behavioral, and social support systems. So as we think about populations, we have to think about all of these people and all of their different needs as we move up the risk pyramid. Each of the case studies that we present over and over again follow this approach for segmentation, and this is a general framework that you can use for population health management. Then it's all about co-designing care models, bringing the best evidence to bear, and actually designing care models for particular segments of populations that we serve. And within the care models, we have embedded care pathways. And I just wanted to anchor on this term a bit because we're going to hear this over and over again about care pathways. Care pathways are an absolutely essential part of care models, okay? They are really the steps taken to deliver a care process that includes social care as well, along the entire patient journey for the duration of their condition. And remember that the care pathways are always girded by clinical practice guidelines that we agree to and health standards, for instance, from Ontario Health are embedded within clinical guidelines or within care pathways. Sometimes you'll hear the term care pathway also synonymous with clinical pathway, and just to know that we're referring to the same thing here. Care pathways are really the who does what, when, where, how of delivering care across to particular populations of patients within the care model. And then care models are larger than that. Care models are really systems of care that are often embedded with multiple care pathways and processes inside. There are very often very person-centered, include other components of care pathway, of components to enable care pathways. Care pathways fit within care models, and they're based on general clinical practice guidelines and quality standards, okay? They fit, as you can see in this diagram, they fit in our population health management cycle, really in this co-design of care model phase.